This is a health crisis, not a criminal one. That being said, communities need to be safe.
Starting Tuesday, illicit drug use will once again be illegal in public spaces across BC, such as parks, hospitals, and public transit. This after the federal government approved BC's request for an exemption to its decriminalization pilot program.
What we've done is respond to community concerns. What we've done is respond to what police have been asking for and to deal with public drug use. What they expect their parks, their playgrounds, their streets to be safe areas that they shouldn't have to put up with open drug use.
BC's 3-year decriminalization pilot project began in January of 2023, but after concerns from communities and the police, the province is now scaling it back. Possession and the use of illicit drugs in private residences is still legal, but police now have the authority to arrest those who use hard drugs in public.
We need to continue to reduce, though, the fear that people have that if they are using drugs and they get into trouble, we want them to know they can reach out. We want them to know they don't have to be afraid of calling 911. They don't have to be afraid of reaching out if they're in their home and they're by themselves.
This comes as the BC Coroner Services announced 192 deaths in March due to toxic drugs. Garth Mullins with the Vancouver area network of drug users says this change will only contribute to more deaths.
Unfortunately, lots of people have nowhere else to go. Lots of places in BC have no safe injection sites, there's no housing, so people are just forced into the public. What this change does is it will force them back into the alleys and into the shadows.
Mullins says recriminalization only furthers the stigma against drug users, and that if the province wants to save lives, they need to provide more safe supply sites.
If people could get a pharmaceutical version of the deadly street drugs, we'd see those overdose death numbers dropping overnight.
There needs to be sufficient health services in place, scaled out to meet people where they're at, and also law enforcement to have the tools that they need to ensure that public safety is a priority. And then in the case of public consumption, that there shouldn't be disturbances to the public for those who are going about their daily lives.
In Vancouver, Cecilia Hua, City News.